Welcome everyone to the ACA Sign Up for Health Town Hall. We're just getting started here, waiting for a few more people to show up. So just bear with us and we'll get right to it. So thank you so much for joining us tonight. Very excited. And we will get started very shortly. We're just going to wait for a few more people to join us. Just wait another minute and then we will get right to it. I hope everyone is doing well tonight. I hope you have your questions ready. We've got some prepared questions, and we're hoping that you have questions for us too, so we can help you and navigate through the ACA. And I know it's a very complex system. So
you want to see the chat?
For that incident, we saw more illegal immigrants hitching rides down here. Texas DPS.
all right, looks like we're going to get started here. So first of all, welcome to the ACA Sign Up for Health Town Hall. My name is Peter Morley. I'm a patient advocate. I'm also a patient. I started this fight to save the ACA almost 5 years ago now. It seems like a lifetime ago that we were trying to save the ACA, and we still are to some degree. We're trying to enhance it and make it more affordable and accessible for everyone. And we have experts here tonight that are going to help you navigate through open enrollment, which starts on November 1st. For most states, it runs through January 15th, but some states are on an individual marketplace and have extended open enrollment. And we'll talk about that as well. But if you are signing up for the ACA, you want to sign up before December or on or before December 15th. So your coverage will start on January 1st, 2022. And again, I'm not going to take up much time. I'm going to introduce our experts because they are the experts that we asked here tonight. I am just somebody who testified for the ACA 3 times, but these people that are here tonight on our panel are our experts and are extremely knowledgeable, way more than me, if you can believe that, on the ACA, but they are. And I'm so pleased to have them. And I'm just going to introduce them, and then they're going to introduce themselves. We have Rawha Abouarabi, who is the coordinator of Public Health Navigator Program for Access. Charles Gaba, who's a healthcare policy analyst and founder of ACA Signups.net. We have Louise Norris, who's a health policy analyst for healthinsurance.org. And we have Mina Schultz, who's the ACA Outreach and Enrollment Program Manager for Young Invicncibles. Such a pleasure and a privilege and an honor to have them all here tonight. So going in alphabetical order by last name, we will start with Rawha. And if you could please introduce yourself and let you take it from here.
Yeah. Hello, everyone. Thank you so much for joining this panel. It's very important and crucial time as approaching to November 1st, open enrollment. My name is Rawha Abouarabi. I coordinate the Navigator program at Access. I've been working with Access for 17 years, and I started as Navigator myself from the first day ACA announced and get into effective. I'm very happy with the achievement we got with the ACA enrollment and with the support we provided, and we were able to provide people who are uninsured And we'll talk more during your questions. So I hope you enjoy your night, and we will be more beneficial to any question that can support you.
Thank you so much. Next is Charles Gaba.
Yes. Hello. Thank you. And I wanted to thank both Rachel and Peter for inviting me to join this esteemed panel. I know most of the other folks on this panel, except for Rawha. This is the first time that we've encountered each other, but very much appreciate it. As Peter mentioned, my name is Charles Gaba. I am the founder of a website that's called acasignups.net. This is sort of an accidental thing for me. I sort of stumbled into this 8 years ago. Gosh, 8 years ago, I was a website developer, and I just sort of stumbled into. I'm a data hound, and I started tracking numbers and data and so forth, and it sort of went from there. Now I do a lot of policy analysis, data analysis, and so forth. I too, as Peter mentioned, have as all of us here, we've gone through the trials and tribulations of the startup issues with the ACA, and then the saving the ACA a few years ago. And now hopefully we're in a position where we're moving the ACA forward and expanding and strengthening it. I'm very excited about the American Rescue Plan was the biggest step forward for the ACA since it first started, I would say. And now the next goal, of course, is to try to lock in those advances and work from there. So 2022 open enrollment it's a whole different ball game. The ACA is mostly safe at this point. I'll always cross my fingers on that, but more to the point is that the financial assistance and so forth is much improved for this upcoming year, and there's a lot more choice and options in almost every state, I think. And so it's a very exciting. This should be a very exciting open enrollment period. And yeah, just here to help.
Thank you so much, Charles. Next, we have Louise Norris.
Right. Hi, everybody. It's really great to be here. Thank you, Peter and Rachel, for inviting me to join this group. I have been working in the individual health insurance sphere for almost 20 years now. My husband and I own a small health insurance brokerage in Colorado. And for the last 15 years, my focus has been primarily writing about health insurance and healthcare reform. And it started out as a process of just sharing information with our own clients, and then it just grew from there. You'll find most of my work at healthinsurance.org now, but I'm also the health insurance expert for Verywell. And my focus is, I pretty broad focus on health insurance, but I do tend to target the ACA, individual health insurance market, Medicaid expansion. As Charles said, everything that's happened this year with the American Rescue Plan has just been great for people who buy their own health insurance. And there's more exciting things to come ahead, depending on how current legislation ends up. And I am really excited about this open enrollment period because I think that there's so much more financial help available for people. There are more plan options. We just need people to know about it, to get out there and look again if they maybe haven't looked for the last couple of years. Maybe they looked a few years ago and then nothing really worked for them. So we just really want to encourage people to go back and shop again, because this is different from any of the previous open enrollment periods we've had in terms of, how affordable the coverage is. So looking forward to whatever questions you have.
Thank you so much, Louise. And last but certainly not least is my good friend, Mina Schultz, who is also my inspiration. Mina, so grateful to have you here.
Thanks, Peter. Thanks everyone for being here tonight. Super excited. As Peter said, my name is Mina Schultz. I'm the ACA Outreach and Enrollment Program Manager at Young Invicncibles. If you're not familiar with Young Invicncibles, we're a national research and advocacy organization that's committed to lifting up the voices of young people in the political process. So You know, we work on issues that impact economic security for young people, things like higher education, workforce development, and of course, healthcare. So while we work primarily with young adults, our advocacy is for accessible, quality, affordable health coverage for everyone. So that's what we advocate for at Young Invincibles. Personally, I got my start as a certified application counselor back in 2014, right before the second open enrollment period. I worked at a community health center in North Central West Virginia, where I helped people enroll in marketplace plans and Medicaid, and also doing a lot of health insurance literacy and outreach work at that time too. From there, I moved to New York City, where I worked for the City of New York Public Engagement Unit, primarily serving the neighborhoods of South Brooklyn, doing, again, health insurance literacy and outreach. So today I'm with Young Invincibles. I'm happy to say I continue to help consumers learn about health coverage as a registered certified application counselor, but I also work with enrollment assisters across the country who help people enroll in coverage. So I help give them the tools that they need to help folks get access to coverage through the marketplace. So I'm really excited to be here. I think it's going to be, you know, like my other panelist friends have said, it's going to be a good open enrollment. We've got expanded financial help, we've got an extended deadline, and we've got expanded navigators. So, and we don't have a huge election that we need to shout our messages over. So I'm very optimistic and I'm excited to have this chat with everyone tonight.
Thank you, Mina. This is, it's really great to have you all here. So I think we're going to delve right into the questions right now. And the first question, and this is a question that I've heard quite often, and I'm just very curious how each of you are going to answer this, but I would like, we'll start in the same order. I want to get everyone's just quick answer. Is the ACA marketplace Obamacare?
Okay.
Rawha, you could start.
Yeah, you know, I laughed because this is in the beginning when we started, a lot of clients came and they start asking, we want the Obamacare. So when during our conversation, when we mention marketplace, he or she will say, no, we want the Obamacare insurance, not the marketplace. So this was in the beginning confusing to people. Yes, marketplace, it's the same as Obamacare, but it depends how people, because in the beginning it was signed by the president, prior President Obama. So people were familiar more that this is initially Obamacare insurance. So they were not acknowledge the fact that this is a marketplace. It's the same as the Obamacare insurance. So we were having this conversation a lot with our clients and explaining that it is the same one. We are signing for the same insurance that you came for.
Charles?
Yeah, well, it's funny because Rawha just noted that early on, there were some people who were saying, "Oh, I don't want the marketplace, but I want Obamacare." Well, the irony is that, as I think most people know, especially in the early years, in a lot of cases, it was the other way around. People would say, "I don't want any, I don't want any of that Obamacare stuff. I want the Affordable Care Act." It's like, well, it is about, it is they're the same thing. But it's important for, we laugh, and it's been a long time, and you would hope that, most people know this, but there's still a lot of confusion. And what is important for people to understand is that, the full name of the law is the Patient Protection and Affordable Care Act. It's usually shorthanded as the Affordable Care Act or the ACA, sometimes the PPACA for patient protection. But all of that, it is Obamacare. Obamacare is just a nickname that was, came up with around the time it was passed, and it just sort of stuck for good or for bad, depending on who you talk to. But the other thing that confuses people as well is the fact that the law itself is it's a big overarching law that covers a lot of different areas of the U.S. healthcare system. When you're talking about the open enrollment the marketplace or the healthcare exchange where people are buying health insurance, on the, through healthcare.gov or one of the other exchanges, that's only a part of it. So there's a lot of this other stuff that's about law but usually that's what they're referring to, I think, is open enrollment through the ACA marketplaces. And the other thing that confuses people within that is that there are multiple marketplaces. There's a federal one, healthcare.gov, that's like the mothership. And that one around, what is it this year? I think around 33 states. If you live in about 33 states, you enroll through healthcare.gov. And then the other states, it was 13 last year. This year it's going to be 16 because 3 more states are splitting off. There are 16 states that have their own ACA exchange. And so that in California, it's called Covered California. In New York, it's called New York State of Health. And, there's different names in each state. And so that can confuse people as well. But those are still the official ACA, Obamacare, Affordable Care Act, healthcare marketplace, websites. That's still the official site where you would buy an ACA policy and where you would hopefully be, qualify for subsidies, especially this coming year.
Louise.
I cannot
Thank you,
add
Chris.
anything to that.
Sorry.
It is summed up.
Okay, Mina. Anything?
You're on mute.
Oh,
There we go. I wasn't allowed to unmute there for a second. No, just to reiterate what Charles said, basically, I feel like there's Obamacare, there's the Affordable Care Act, and there's the exchanges that are used kind of differently by different people. I think people who do the policy and who work in this kind of stuff know that the Affordable Care Act is, like Charles said, a big umbrella law that impacts a lot of different areas of health coverage and healthcare. People who work in this also know that as Obamacare, but then there's the people who are kind of out of this sphere of health insurance expertise, and that's where Obamacare sometimes comes to mean the marketplace. So I think we've got like 3 different terms that are kind of used differently by different people, and it would just be super helpful if we all got on the same page with that.
and I just want to add that I'm not going to say who, but during my testimonies, there were certain members of Congress who seemed to use the word Obamacare pejoratively, and it seemed that when the Democrats seemed to use ACA, where Republicans would use Obamacare and not say it in a very nice way. So it was almost like it was a 4-letter word, even though technically with 3-letter, well, it's more for the patient protection. But anyway, you know what I'm saying. So it seems to get used a lot like that as well, in the media too. There's that, I think, adds a little to the confusion, but that's just my own personal objective opinion. So we're going to move on to a question that was asked to us. It's a very, very important question too. This person lives in New Jersey. I've been getting my family's insurance under the ACA, now Get Covered New Jersey, as the panel just explained. There's healthcare.gov, and then there's individual exchanges, and I believe Charles said 16 this year. Now Get Covered New Jersey for several years, but this year it has been terrible. We are paying everything out of pocket and have virtually no coverage until we fill our $17,000 deductible. My question is, how can we avoid the same situation for 2022? We have skipped important tests and visits because of this, and I know we can't go on like this. I appreciate any info you can give. So anyone who wants to jump in, Louise,
Sure.
Go ahead.
Sure. So this is a great question. It's really interesting that it comes from New Jersey, because New Jersey is fairly unique in the country in terms of capping deductibles. In most of the rest of the country, you could definitely find marketplace plans for a family that have a $17,000 total out of pocket for the family. New Jersey does cap deductibles though at around $2,500 or $3,000 per person. The only exception I can think of on that would be if maybe this person has two catastrophic plans, two spouses each have their own catastrophic plan. In that case, they would have a combined deductible this year of $17,100. So my advice, if your deductible is so high that, and this would apply in every state, not just New Jersey, if your deductible is so high that it's causing you to skip necessary health care, you're really going to want to look at the more robust plans that are available. Chances are you either have a catastrophic plan or a bronze plan, and you might want to consider the silver plans and the gold plans that are available in your area. Yes, you'll probably pay more in premiums each month, but you'll have lower costs when you need to go get healthcare. And if the costs you currently have are actually keeping you from getting healthcare, then it's probably worth it to pay more in premiums and get a more robust plan. Does anybody else have any thoughts on that?
Well, I mean, just to note that, again, I don't know what this person's, personal situation is, but in general, this year in particular, I would strongly recommend anyone who's been on a catastrophic or bronze plan because the premiums, were just too high because they either didn't qualify for financial help, or the financial help that they did qualify for seemed kind of stingy or whatever. I would strongly urge you to go back and check again and look at the silver and gold, and if some states even a platinum plan, but because the subsidies are much more generous, and they're much more generous for many more people. Up until the American Rescue Plan, there was an income cap. So if you made more than a certain amount of money, you qualified for nothing, and it didn't matter how expensive it was. It would taper off to a point, and then it would just drop off to nothing. And that is gone, at least for 2022. So hopefully, permanently. But so I would strongly urge people to look into that, and if you've been sort of skimping out on on a plan because you can't afford it, double check for 2022, because there's a very good chance that you'll find something much more robust for a very affordable price.
Does anyone have anything to add to that? Okay, we're going to move on to the next question. And this was a question just posed to me, and it was a great question. It's a very interesting question. They asked to be named anonymously. I am taking a career break at the moment, so have lost my employer insurance. COBRA is too expensive. I am living off investments. When looking for a plan, are my investments that I draw on considered income? I don't want to report zero for income, as I don't feel I am appropriate for Medicaid, but I don't know what to put for income.
I can take that one.
Okay.
So yeah, it's in almost all cases, it's what's going to be your adjusted gross income on your tax return. There are a few things that do get added back to that. If you have tax exempt interest, say from a municipal bond fund, if you have foreign earned income, and if you have non-taxed Social Security income, those three things do have to get added to your AGI. But a lot of people don't have those things, and so their AGI is just what counts as their income. So in answer to that question, if you're if you're pulling from investments for your expenses, it's going to depend on whether you have capital gains. If those are capital gains, then yes, you would pay taxes on them, and so they would be counted as part of your income. If you're pulling money out of, say, a Roth IRA, that is not going to count as income, as long as you're, past the age where you can do that with, and actually Roth contributions, the contributions you put into a Roth are never going to get taxed. If you're pulling money from a traditional IRA, that is going to be taxed. So it's basically just if the money you're taking in is taxable income, it will count. And like I said, those other three things would need to also be added as well. So
Does
anybody else add to that?
Thank you, Louise. That was great. Here's a great question. What are the deductibles like for 2022 and how are they determined? Anybody want to take a crack at that one?
Is Rawha talking or?
Oh.
We're all stunned.
I mean, I can certainly give an answer, but I wasn't sure if there was somebody else was trying to talk or not. So the maximum out of pocket that's allowed has increased to $8,700 for one person for 2022. As I mentioned before with New Jersey, and there are some other states that have limits here and there where deductibles have to be lower, for example. If you have an HSA qualified plan, the out-of-pocket limits are lower on those as well. It's just over $7,000 for 2022. Deductibles are on most plans lower than the maximum out-of-pocket. You meet your deductible first, then you have other expenses that get you to your maximum out-of-pocket. If you have a catastrophic plan, the deductible will be equal to that $8,700 maximum out-of-pocket amount. So they vary tremendously from one plan to another. Some plans have zero deductible. Some plans have an $8,700 deductible. It varies depending on the insurance carrier, how they've structured their plan, whether the plan is bronze, silver, gold, or platinum. If you get a silver plan and you qualify for cost sharing reductions, which are available to people who earn up to 250% of the poverty level, you'll have lower deductibles. So there is just a ton of variation. There are also a ton of plans available for this year. We were just looking at that this evening. Something like 30% of people on healthcare.gov will have more than 100 plans to choose from this year. So there is just a tremendous range of options. You're going to be scrolling and just looking at all the different things, and highly recommend find some help, find a navigator, find a broker, somebody who can help you narrow it down. But yeah, deductibles are all over the map.
Thank you, Louise. Charles, were you going to add something?
Yeah, I mean, if again, I don't want to step on anyone's toes or anything. The other thing, I would just a couple of points about deductibles in general. The first thing is that, as Louise mentioned, if your income is up to a certain threshold, then you'll qualify for something called cost sharing reductions, which is basically there's two types of financial help you can get. The main one that most people know about is the premium subsidies, but there's also up to a certain income threshold. It's called cost sharing reductions, or CSR, and that's what cuts down on your deductibles and other out-of-pocket expenses. And so if you earn up to around, Louise, they're available up to 250% of poverty, but from 200 to 250, it's a little stingy.
Not great. Yeah.
Yeah. So really, my general recommendation is if you earn less than 200% of poverty, which is, what is that, around 26,000 a year if you're single?
Yeah, it's going to be just under 26,000 for a single person in the continent. Yes.
And then what was it for a family of four? It's like
it's 26,000. It's going to be 52, 55, somewhere in that range.
Something like that. If your income is below that threshold, I strongly recommend looking at a silver plan, because that will also, it's called silver. I mean, it's officially silver, but it includes this extra help that basically makes it the equivalent of a platinum plan, essentially. So you get this, you'll get decent, really good premium subsidies, but you also get a really very generous cost sharing reduction, which will chop that down dramatically from that 7,000 or 8,000 that you mentioned down to as low as maybe a few hundred in some cases, I believe.
And I just want to add one thing that I always recommend when clients ask those questions. What's good about the ACA application? the tools of calculation, the tools of trying. I mean, we don't have, I always advise my client, you know what, I'm willing to sit with you. Let's view the plan together. Let's submit the application. You're not obligated if you're not happy with it, but it's worth of trying, especially that's now we have like 100 plan to view. And I always tell the clients this way because I want to make sure they do have insurance. I want to make sure they visualize what they can afford. Sometimes if we tell them by talk, sometimes big numbers scare the clients if he or she capable to pay that. But when they go and run the application, many people come hesitated until we run the application. So when we sort with them and we find them how much, and we show them the difference between picking up, let's see, the Browns brand plan and the silver plan or the gold plan, and they see the difference of prices, they convince, you know what, no, even though this deductible is scary, but you know what, it's covering, as Charles say, so and so and so and so. It's like you're having a platinum plan. So I always advise, let's to do the application, run the application and see your options, because you're not paying anything. You're not obligated if you don't feel like you could afford it. You're not obligated to get the plan, but at least you gave yourself a chance to get insured. So this is my recommendation for everyone hesitating about deductible, premium, out-of-pocket costs, to run the application and evaluate and examine your income, your capability, if you can pay or not, and weigh your winning and winning case, you know, losing or winning. Is it worth of buying this, worth of having insurance all the time, able to see the doctor, able to go to emergency, urgent care, not paying, not being accumulating with bills that you cannot afford, and so on.
Thank you. Mina, do you have anything to add to that too?
I don't have anything to add, but while we're kind of on this topic, I see another question in the chat box. What dollar amount is considered a high premium? The premium is what you pay on a monthly basis to maintain your coverage, and that's completely subjective. What is a high premium to me might not be a high premium to you, and vice versa. So some people, depending on their health status, depending on their budget, depending on just what their priorities in life are, might not be able to spend more than $10 a month on coverage. As a cancer survivor with lots of conditions, I used to pay, when I was on the marketplace, over $500 for my gold plan, and it was well worth it. I would have paid more if I had to. So high premium is kind of subjective. It's all about what you can afford, what you need, and what's a priority as far as your healthcare goes.
Yes, and hopefully as you know, we move forward in the upcoming years, premiums and deductibles will get more and more affordable, especially now that some insurance companies have come back into the marketplace. It makes it more competitive. And thanks, like Charles was saying earlier, to the American Rescue Plan, there are a lot more affordable plans now than ever before. There is a really great question. Any thoughts on subsidy gaps have a chance of being filled, like spouses not on group plan or Medicare, where other spouse on one or latter? It's a I feel bad complaining, but without subsidy in Minnesota, 61-year-old bronze is $607 a month. So that is just getting you preventative care and network discounts, and out-of-pocket cap $7,000. That is better than alternative, but is playing Russian roulette. Paying more than bronze is hard to cost justify. This is kind of what we were talking about, but anybody have any thoughts on that?
Well, I mean, I would just say, you know, I'm assuming, and I see that in the chat, I'm assuming that's what they are paying currently, like for 2021, or, you know, without knowing
Right.
if that's what they, because, you know, the thing about the American Rescue Plan is because the additional subsidies were, it's for 2 years, it's for 2021 and 2022. But of course, the bill, you know, the bill didn't pass until the part way through the year. And then it took a few months for them to, you know, implement it. So a lot of it was done retroactively. So, you know, I don't know for sure, but this person may, it's possible that they'll be getting some additional, you know, or getting some subsidies after the fact. I'm not sure how Minnesota's handling it, if they're doing it month to month or if they're doing it as a lump sum when you file your taxes next year, but it's possible that you may end up getting like, you know, several $1,000s possibly. I'm not guaranteeing that. In an additional, you know, tax refund when you file your tax return next spring. That's for 2021. For 2022, all of these, the expanded subsidies are all like out of the gate, like, you know, November 1st, boom, go, and they're all supposed to be locked in. So, you know, I would definitely double check and see, and it's entirely possible that you may see a much more affordable, you know, plan for 2022. Now, beyond that, of course, that's going to depend on, you know, like the Build Back Better bill that is pending in Congress. They're hoping to extend those additional subsidies, you know, into the future. So we'll see what happens. But for 2022, at least, yeah.
I think part of the question there might be when they were referring to subsidy gaps. I think they might be talking about the fact that when you have a spouse go on to Medicare,
oh, I see,
the costs that like if your whole family is on a marketplace plan, your subsidy is based on the cost of that marketplace plan versus your household income. If you have part of your family on other coverage, whether it's employer sponsored coverage or Medicare, whatever you pay for that coverage for the Medicare, which can be substantial depending on what Medicare coverage you get, or for employer sponsored coverage, that isn't taken into consideration. So you're still then looking at whatever family is left, maybe just one spouse or, you know, part of the family on a marketplace plan. That cost of that marketplace plan is compared with your whole household income, and the expense you pay for your Medicare coverage isn't part of the equation. And so it can definitely make it for people. It can be really counterintuitive for people when you go from having, say, two spouses, maybe one's 63 and one's 64, and they're on a marketplace plan. And then all of a sudden the 64-year-old turns 65, goes on Medicare. The remaining spouse will usually still be paying the same amount in total premiums that they both were paying before, because assuming your income hasn't changed, you know, and so that can be counterintuitive for people, because then all of a sudden they're actually paying a bigger percentage of their household income in total premiums, because they have to pay that Medicare cost out of their household income. And so if I'm understanding the question right, I know that is a confusing topic and it oftentimes comes up, but just to clarify, there's nothing that I know of, Charles, Mina, Rawha, if you've heard anything. I don't think there's anything being talked about in the current legislation that would address that. It's just an unfortunate reality of that transition when part of the family is still remaining on marketplace and part has moved over to Medicare.
Thank you, Louise. I'm sorry, there was a question that I was gonna get to, sorry. All right, this is a question for Mina and Rawha. Where would you recommend finding a broker or navigator to help people sort through all those plans? So Mina or Rawha, which one? Go for it. Oh,
Yeah, there's some muting stuff going on here.
Yes.
sorry.
I've got sirens. That's my problem. I'm sorry, everyone. 2 places. So, like we said, the federal marketplace, healthcare.gov, is where you start shopping. There's a part of healthcare.gov called Find Local Help. There's a button for it. If you scroll down a little bit, I think it's towards the right now. Changes places sometimes, but it's called Find Local Help. You can go in there, you can find a broker or an assister. really just someone in your local area who will help you. They actually just added in the last couple of days part to Find Local Help that tells you how long the assister has been doing this work, so you can tell how experienced they are, which I think is going to be really helpful for people looking. You can also go to getcoveredamerica.org and put in your zip code and find an assister that way. So 2 different ways: healthcare.gov, Find Local Help, or getcoveredamerica.org.
Yeah, I would like to add to that. This year, ACS has got the state fund for 3 years, which is we are now, Access is presenting the state for the new grant, and there's under Access 23 subcontractors that are working for the ACA, which is, you could say, around 45 navigator are newly assigned for the ACA Navigator. So there's a lot now, it's widespread in navigators all over, and we are so happy to be the leader for this training, for the trainees, a leader for the navigators, on behalf of the CMS. So we are more than welcome to find the location as well. You could go under healthcare.gov. When you put the location, you could now find widespread on many counties. And yeah, that's close to your home, whether Dearborn, Wayne County, Kent County, so many places that you can find now, wide range navigator that they could assist you in sorting the plans with you. And if you are able to come to Access, you are more than welcome to come. We have a lot of navigators that can assist you as well.
And just, I just want to throw there, it's commission free, correct?
Oh, definitely. Definitely. It's commission free, and we are so expert and patient to sit with the client and navigate with them. And even if it's a long process, we could schedule for another time, and which is we always do that to give a chance for the client to examine, evaluate, comprehend or think about the way which one they want. So they are more than welcome. And we have a main number too, if they like to call and schedule an appointment. We'll do it on appointment scheduling too. We have the connector. We use the scheduling online. Anyone can go to the connector. I would put the link down there in the chat. They could go in to the connector and schedule with any navigator, and that's close, even find the location as well with any navigator through us or through the connector, and schedule it online. We do serve still people. If they prefer virtually, we do it. If they prefer through the phone, we do it. And if they prefer in person, we'll do it as well.
Oh, thank you so much. Thank you all. I see that it's already 8:45, so I want to make sure that we cover all the. Let's go back to the basics of this year of 2022's. So for the 33 states that are still on healthcare.gov, the enrollment date to be enrolled for January 1st, 2022, you have to enroll by December 15th, 2021 to be enrolled on January 1st, 2022. If you enroll between if you enroll, all right, let me get this straight. So I'm going to answer my own question. If you enroll between December 16th and January 15th, then you will be enrolled on February 1st, 2022. Mm-hmm. So it's very important that you enroll by December 15th to be enrolled for January 1st. Otherwise, you will have a gap in coverage if that's, or you will, or you'll stay on your plan. I guess that's how it works, right? That's how it works. You'll still stay on your plan. Your new plan will not be effective till February 1st. But let's talk about just some basic things. Is mental health covered through the ACA?
Yes, it's
Okay.
one of the 10 essential health benefits. It has to be covered by marketplace plans at the same level that medical care would be covered.
It's good to know because a lot of people don't know that. How about if somebody is on a plan at their work and they are they allowed to look at a marketplace plan?
Yes, anyone can look at a marketplace plan, and if they want, I mean, if they really don't like their employer plan and they want to, buy one through the marketplace, they can probably do that. But the key is that whether they qualify for the financial help. If they want to pay full price, sure, but most people, there would be no point in that for most people. So if you the deal with employer coverage is that if your employer either A, does not offer healthcare coverage, or if they offer it, but it costs more than there's a threshold there's an affordability threshold. If it costs more than that threshold for the lowest, basically the lowest price plan, if it costs more than that minimum threshold, then then you can enroll during open enrollment, and you'll probably be, eligible for subsidies based on your income and such. But if your employer coverage is, decent, and of course your definition of decent may vary, but if it's considered at an acceptable, minimum threshold by the under ACA terms, then you won't qualify for the subsidies. So, you would have to pay full price, which would kind of defeat the point. So.
Here's one last question, and this is directed at you, Charles.
Oh.
I've heard about something called silver loading, which is supposed to help me save money. What's that all about?
Okay, I am not going to get into the 7 or 8 year saga behind this. It's a long, stupid story that involves federal lawsuits and a whole bunch of stuff. But the bottom line is this. And I sort of alluded to this a little bit earlier about that 200% threshold with the silver plans and the CSR help. The bottom line is that there are normally, you would think this seems logical with the metal levels, right? You have bronze, silver, gold, platinum, and the idea is supposed to be bronze plans have the highest, they have the lowest premiums but the highest deductibles, and then platinum has the highest premiums but the lowest deductibles, and then it's sort of, they shift as you go up. However, due to a whole bunch of weird stuff that happened over a number of years, in a lot of the country, and I won't say the entire country, it depends on the state, depends on the county, but in many, many hundreds of counties around the country, you will find gold plans, which you would think would cost more, but which actually cost less than silver plans, or around the same, or only slightly more. But in some cases, they'll actually cost less than a silver plan. Which means that you'll get a lower deductible, lower out-of-pocket costs, and possibly a lower premium than a plan that you would think would cost less. So it's again, there's a whole weird reason behind it. It does make sense from an actuarial number crunchy standpoint, but as an enrollee, as someone looking for a plan, that's the main thing you have to look for is, and again, if your income is below that 200% threshold, I definitely strongly advise getting a silver plan anyway, because you'll get that additional cost sharing assistance to hack down and the other costs. But if your income is 200% and up, strongly recommend shop around and take a closer look at the gold or possibly even platinum plans. I don't think there are that many of them these days, but gold and platinum plans to see if you might actually get a better deal on a gold plan than on silver. But again, only if your income is over that 200% threshold. And that's called silver loading. And again, the name and the reason behind the name doesn't really matter. Just remember that.
Well, thank you, Charles. All right, here's a great question. I'm going to ask 2 more questions, and then we're going to wrap this up because it's Thank you. You've all done such a tremendous job tonight. I really appreciate this. A lot of information. Even my eyes are glazing over. It's just wow. All right. I signed up during the COVID-related enrollment period in the summer of 2021. Do I have a full year to meet my deductible, or does it start over on January 1st? Who wants to take a crack at this?
Sure. No, you do not have a full year to meet your deductible. All individual market plans in the marketplace are going to reset on January 1. And that's true even if you get married in November and sign up for coverage that starts December 1st, that plan is only going to last for a month because they all start over January 1. So if you signed up this past summer during the COVID-related open enrollment period, you have until the end of December to, so if you have already started meeting your deductible, maybe you've already met it. These last couple months of the year are a great time to take care of things that still need to be taken care of that the insurance company will pay for now that you've met your deductible.
Replace all your organs.
On January 1, it's starting back over at 0. Whether you renew your current plan or switch to a different plan, it won't matter.
Well, I am going to now ask all of you to give your final thoughts on anything that we've missed, anything that you want to add, anything that you think is important for everyone to know, and then we will call it a night. And I just want to say in advance, thank you all so much for being here. These were amazing questions, very, and in some cases complex, and we realize this is a complex. That's why we have experts on this panel. So we really appreciate you all being here. But again, Rawha, we'll start with you and any final thoughts you have. I was just waiting for you to unmute.
Okay, I'm always waiting for someone to unmute me. I'm happy to be here. Actually, it's all questions were valid, were reasonable, and I'm glad that people are considered those questions. It's mean the ACA, it's in mind, and people are interested to enroll. The most important thing I want people to know that ACA was very, very much helpful for people who are a new immigrant. This is make a big difference in people's life. These people they were not eligible. We deal with Medicaid and ACA insurance. Before ACA existed, we were really, really hurt and were frustrated for the client because the ones that they come as a new immigrant come in for from different countries, probably they weren't I don't want to go in politics. So I will say they came here to feel safe, to have a healthier life in a way that they could afford to go to the doctors, emergency room, urgent cares. So also new immigrant with the law of Medicaid that new immigrant under 5 years are not eligible to have full coverage. Only emergency, it did affect them big time. This law affect them big time because they've been staying years after years until they become resident for 5 years or they receive their US citizen. So imagine those coming with kids that they cannot afford see a doctor, urgent care, and they go to the emergency room as only solution for them, but they end up with bills accumulating and deficiency in hospitals because hospital too cannot afford much more people come in without able to pay the bills as well. So ACA came as really saving those people because now we can enroll those clients, those immigrants with ACA with affordable pay until they are available or eligible to Medicaid. So I just want to highlight this important fact that ACA did make a huge difference on people, because we've been dealing with this frustration. We've been dealing with the clients, and we're feeling so hopeful that we could not help them because what's the state Medicaid law, this is the way it is, and they have to follow it. So I'm really, really grateful that I'm working in this program, and I'm able to help and make a difference, at least with my small contribution time, effort, explaining the insurance for the clients. And so I know the ACA role, it's big deal, and sometimes people frustrated from the out of pocket, but if we see the other side, how much many people been suffering without being able to take their kids to the doctor in the US, so that's some things like we should be really highly appreciated. And thank you for having me tonight.
Thank you, Rawha. And Charles?
Sure. Yes, thank you again. Thank you, everyone. Yeah, if there's one main takeaway I would say for this year in particular, this is true every year, but do not auto renew your plan. If you're currently enrolled in a plan, I mean, if you're new to the marketplace, shop around and get a good and see what deal you can get. If you're a current enrollee, do not let yourself be auto renewed. That does not mean don't renew your existing plan. For some people, your current plan may be the best, the best thing, and then you actively renew in the same plan. But don't let yourself be auto renewed without going in and checking, because even if you think you have a great plan and it's a reasonable price, there may be an even better plan and even better price for you, especially this year in particular. Again, these expanded subsidies and there's always changes. There's always changes in plans and prices and and subsidies and all that from year to year. But this year in particular, it's a really big deal, really important that there are some phenomenal values out there for millions of people this year. And there's a lot of like zero premium plans that are available, even zero premium gold plans in some cases. And as I said, again, if you're below that 200% threshold, the odds are that you can get again, it's called silver, but it's like silver is the new platinum. I guess you'd say, where it's basically the equivalent of a platinum plan for either zero premiums or or very nominal premiums for many people. So I will just say that.
Thank you, Charles. Louise?
I would second everything that Rawha and Charles have just said. I completely agree. I know the ACA itself has always been a bit controversial, but my perspective as someone who was working in the individual health insurance industry for several years before the ACA, it was heartbreaking to have to tell people, I'm sorry, you cannot get coverage. The insurance companies will not take you. And people would say, but how can that be? I haven't had a gap in coverage. I am just coming off of an employer-sponsored plan. Well, that didn't matter. There were only 5 states that had guaranteed issue coverage in the individual market. It didn't matter what your prior coverage was. If you had significant pre-existing conditions, the insurance companies in the individual market could just reject your application. And that hasn't happened now since the end of 2013. And that is a really awesome thing, and building on what Rawha said about it being so helpful for immigrants, it's also so helpful for just anyone with pre-existing medical conditions, because they can have the flexibility to switch from one plan to another. If you are shopping for health insurance right now, you're not constrained by the fact that you have a pre-existing medical condition, or maybe you had one last year, or maybe you're pregnant right now. Well, pre-ACA, you just get rejected. Now you can switch to a new plan if you're 6 months pregnant, and your new plan will just pick right up and cover you. Those sort of things aren't a problem anymore, and that's a really huge improvement. One other point I did want to make is I do still see people online here and there on forums saying, oh, I can't get ACA subsidies because I earn too much money. I make more than 400% of the poverty level, because that number has just been burned in people's heads for the last several years. The American Rescue Plan eliminated that income cap for this year and next year, but it did it for this year, like Charles pointed out earlier, retroactively. So if the last time you looked for coverage was a year ago in the fall of 2020, and you made more than 400% of the poverty level, it was going to show you that you were going to have to pay full price for your coverage, and you might have said, I can't do it, I'm going to go to a healthcare sharing ministry or get a short-term health insurance plan or just be uninsured. And this is the year to check again, because all of a sudden, just because you weren't eligible in the past, you might very well be eligible now. And you might be eligible for a huge subsidy, depending on your age and where you live. You might have gone from like 0 subsidy to $1,000 a month subsidy or more, depending on where you are. So really, if you know anybody who has just not been insured or they've been on a short-term plan or something like that, try to tell everybody you know to look for coverage in the marketplace this fall. And thanks again so much for having us here. This has been great.
You're so welcome. And again, last but certainly not least, Mina.
We are over time, so I'll be short. I'm going to pick up where Louise left off. I'm going to give everyone, since you're here, you're probably interested in the ACA and health coverage. So action items for you all. Tell people that open enrollment is happening. It starts on November 1st. Don't wait until the deadline to sign up, because there will be a mad rush and you won't be able to get through. Start on November 1st. Tell everyone you know. Even if you think they have coverage, they might know someone who doesn't. So word of mouth is the best way. Shout it from the rooftops. Second action item, look up your local navigator. Go to the website, sign up for health.org, put in your zip code, find your local one. Even if you don't need them, I guarantee you'll be able to recommend them to someone who does need them. And they're the best resource. They're experts, they're local, they're free, they're unbiased. They're not going to tell you what to do. They're going to educate you on what's available to you and let you make the choice. So there's no reason not to talk to a navigator. So tell everyone you know, find your navigator, tell everyone you know about your navigator. And yeah, thanks for having me. This was great. It's been great seeing you all.
Well, thank you all so much. Again, as Mina said, we're a little over time. So I just want to say, remember, open enrollment starts on November 1st, and don't wait. Start looking. You can look now.
Yeah, I was
right?
gonna say, I think almost every, I haven't checked
Mhm.
every single exchange, but I think almost every state, healthcare.gov and almost all, if not all, of the state exchanges already have window shopping open, so you can at least go in and, you know, plug in your, you know, at least plug in your income and info and stuff, and at least get an idea of what sort of help you can get.
So do it now. Don't delay. Your health is the most important thing in your life, as I know, and most of you know as well. So thank you all for being here, and thank you for helping us sign up for health. And it's great having you all. Really appreciate your time and your contributions. Thank you from the bottom of my heart.
Thank you, Peter, and thank you, Rachel.
Thank you, Peter and Rachel. Good night.
Good night.